Welcome, everyone, to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health, reporting for the week of January 13th, 2025. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise to bring you the latest information on health issues relevant to us all. After respiratory viruses update, including human metapneumovirus, I will talk about some recent goings on at the FDA. And a quick reminder, if you have not yet completed our survey about the People's Health Briefing, we would really appreciate your feedback. The link to that survey is in the post. So we know we're in the midst of so-called respiratory virus season, so let's start with the weekly percentage of tests that are positive for the various respiratory viruses. This graph, I think, is helpful because it's showing the whole variety of viruses we see around this time of year and at other times of year as well for some of these viruses. But what we're seeing here is the percentage of tests that can be attributed to these different pathogens. And what we're seeing right now, when you look over to the far right, is that some of the viruses like rhinovirus, enterovirus in the gray, and adenovirus in the light blue towards the bottom there, as well as parainfluenza virus in the yellow, all appear to be trending down, while flu in the bright blue and RSV in the green are clearly heading up. Also down at the very bottom in the black line, that's human metapneumovirus. It is low, but also starting to head up. We'll talk a little bit more about that in a moment. So just a reminder that this graph is not telling us anything about the absolute number of cases. This is just looking at, out of all those people who got sick enough to present for care and get tested, this is the makeup of the results that were obtained. So this is relative to each other, but I still think it's helpful, especially when there are a lot of different respiratory pathogens going around and we want to understand more about what's sending people to the doctor, which could be outpatient, it could be urgent care, it could be the emergency department, or it could be the hospital. And of course, this leaves out anyone and everyone who tests at home. This leaves out everyone who doesn't get tested at all. So number of limitations, but since those limitations probably don't change that much over time, I still think it's a helpful graph to look at to understand trends. Now, when it comes to SARS-CoV-2 and flu and RSV, we know that those are the ones that tend to give us the most trouble, and those are the ones where we do have a lot more information to go on. So with that, let's take a look at SARS-CoV-2 in the wastewater. We can see that it is increasing nationwide. And this is showing us through January 4th, so just a little over a week old now, but that's pretty relatively good recent data. It does show every region increasing. The Midwest is considered very high. All the other regions are either moderate or high. Now, taking a look at emergency department visits for those three respiratory viruses that are reported on during this so-called respiratory virus season, so COVID, flu, and RSV. And like the wastewater graph we just reviewed, this is showing us through January 4th. And what we're seeing here between December 28th and January 4th is a noticeable decrease in both flu as well as RSV emergency department visits and leveling off SARS-CoV-2 emergency department visits. This would be certainly welcome news if this were to hold, so we'll just keep an eye on it. But because we see SARS-CoV-2 wastewater levels increasing, it would be a little unusual for emergency department visits to not increase right behind them. So we'll just watch and wait and see. But I will point out, as I have before, that if we were to see wastewater levels start to decouple from emergency department visits, hospitalizations, and deaths, that would be very reassuring indeed. So what I mean by that is that even if we saw a lot of SARS-CoV-2 in the environment, yet it wasn't causing so much sickness and severe outcomes, that would be welcome. We haven't seen this decoupling yet. We're still having significant sickness and death, but hopefully we will continue to see the burden decrease over time. One big blind spot that we've had in terms of trying to understand the burden is around hospitalization. So ever since the emergency declaration ended, we have not been able to see hospitalizations for SARS-CoV-2. which we were able to see for the entire duration of the emergency order because hospitals were required to report hospitalizations with SARS-CoV-2 to the CDC. So that ended when the emergency declaration ended. But after a lot of discussion and a lot of advocacy, the Department of Health and Human Services is now requiring this again. Actually, they've added RSV and flu to the reporting requirements. So now hospitals are required to report this information. And I've put a link to the post where you can actually pull down this data and even produce different visualizations. But for now, I'll just share with you the visualization that the CDC has prepared and made available. And for that, I will show my screen. So this is the severe viral respiratory illness page on the CDC website. And I've linked this in the post if you want to check it out. I specifically wanted to share the trends in hospitalization rates because, again, this is a new requirement that's been going on since this past November. And so we can see here graphing since November 9th, and we're seeing that flu, COVID, and RSV hospitalizations are all increasing. Flu is making up the biggest share, and we're looking at per 100,000 people. So this is kind of normalized across the diseases and also by state. And so you can take a look at your state if you're interested. So here in California, we can see that it's a really similar pattern, but flu is the biggest contributor to hospitalizations, but it appears that it may be leveling off. And remember, what's in gray here is still preliminary, so still being updated. And it looks like RSV may be the only one that is still on the rise, but it's just something to keep an eye on. The other thing I wanted to point out is that if within a state, less than 80% of their hospitals are reporting, then it will be shown with this open circle here. So I will pick on Wyoming, and here you can see that there's been several of the weeks where they had less than the 80% that's required in terms of reporting. So 70% here, and it seems to be fluctuating from week to week. So still a fairly early requirement for hospitals, but this is a way that you can at least see if you've got 80% or more of the hospitals in your state reporting. So definitely glad to see that this data is now being made available, and this fills in a huge piece of what I think we need to be looking at to understand the burden of SARS-CoV-2 as well as the other respiratory illnesses that cause quite a bit of hospitalization. And now taking a look at deaths, unfortunately, we are seeing deaths heading up in the week ending December 13th, where there were at least 500 COVID deaths. That's compared to 450 the week prior. So we'll just have to keep an eye on what happens as the weeks go on. But if we did already reach our low point the week ending December 7th at 450, that would be disappointing. And the reason I would find that disappointing is because the low point that we got to last year was about 492. And as we know, and as we've seen week after week, the likelihood is that the number 450 may even get adjusted upward as more death certificates are recorded. So at some point, we really want to see that baseline get lower because 450 is really not that much lower than 492, and the 450 may even go up. And so even though the high points in terms of deaths, in terms of our peaks, have gotten lower over time, thankfully, the low points are not improving all that much. And remember, this is very different from flu and RSV, where we go weeks and months on end without any deaths. We really only have to contend with the bad outcomes during the months where it's the respiratory virus season. But so far with SARS-CoV-2, we've actually never even got down below 313 deaths in a week. That was our lowest point. That was this past June. So one of the hopes is not only do the peaks get lower, but also the valleys do as well, because otherwise we're just looking at hundreds and hundreds of deaths every single week, which is just an enormous burden that really eclipses anything that we're seeing with flu and RSV when you look year round. So if we're reaching our low here in the middle of December at the 450 mark, it is slightly better than last year at 492, but not nearly where we want to be. And we know we can do better with this. We know that the risk of hospitalization and death are dramatically reduced with up-to-date vaccination and with timely outpatient treatment if you do contract SARS-CoV-2 and are at risk of a bad outcome. So let's encourage those updated vaccines. Now's a great time if you haven't gotten it yet, and also that timely testing and treatment. Now, taking a look at flu, this is taking us through the first week of the year. There have already been over 9 million illnesses, 110,000 flu hospitalizations, and 4,700 flu deaths, including 16 pediatric deaths so far this season. Best way to protect yourself, best way to protect your little ones is the flu vaccine. I went over in some detail in last week's briefing about how the vaccine seems to be performing this year. So if you're interested, check out last week's briefing. But the bottom line is the best way to protect yourself and your loved ones is the flu vaccine. And also, if you do start having symptoms and you're in a higher risk group, get that test as soon as possible and get started on an antiviral right away. That would be your best bet to prevent progression. And now coming back to human metapneumovirus, I was surprised to see this hit the headlines the way that it did. The headlines were definitely insinuating that this was a new virus. I got some calls and messages from folks concerned about this virus. Is this a new virus in China? How worried should we be? Well, suffice it to say, this is not a new virus at all. Human metapneumovirus has probably been around for a very long time, although we really only first identified it a couple of decades ago. So over 20 years ago, but in the scheme of things, that is fairly new. We rarely talked about it, I think, until more recently, but it is known, it's not new. From what I can gather from reports from the World Health Organization, it seems that Chinese officials are providing the World Health Organization with information. Their hospital systems do not appear to be overwhelmed. The severity of the illnesses they're seeing with human metapneumovirus don't seem to be out of the ordinary or more severe or anything like that. And as I showed on the first slide, today, human metapneumovirus is just starting to tick up here in the United States. It usually comes in late winter, early spring, and it looks like that will probably be the pattern this year as well. It can be more severe in children, especially little ones under 5. We've also seen co-infections with human metapneumovirus and like COVID or other respiratory viruses, in which case you certainly can get more sick. There is no specific treatment. There is no specific vaccine. So really what we want to do, just like if you get any other respiratory illness, is first rule out what we can rule out what you can treat. So if you get COVID, if you get flu, and if you're in that high risk category, we want to get those diagnosed right away so that we can get them treated right away. And other than that, we're really just going to provide supportive care, treat it like a cold, and obviously seek medical treatment if the symptoms are prolonged or if the symptoms are severe. So nothing new to see here. Now, I wanted to take a few minutes to talk about some goings on at the U.S. Food and Drug Administration, otherwise known as the FDA. There's been a lot of talk about the FDA and who's going to be heading it up and how things might change as a result. But I wanted to point out that there have been significant reorganizing efforts already underway. In fact, about 2 years ago, in January of 2023, the FDA announced that it was going to be proposing some reorganization, which it did propose in December of 2023. And then the proposal to reorganize was approved in May, this past May 2024. And the reorg was implemented just this past October 1st, 2024. And the focus of this reorganization really seems to be around food. So the F part of the FDA. We know that we seem to hear a lot more about FDA's role in oversight of drugs, medications, vaccines, and so on. So it can sometimes seem like the food part might be taking a back seat. And even as it does relate to food, the focus has always tended to be on food safety, not so much about the nutritious value or lack of nutritious value of our foods. So this reorganization is reportedly the single largest reorganization in the agency's recent history. It impacted more than 8,000 employees, and it's meant to integrate and modernize across various functions and programs of the agency, from laboratories to food safety and nutrition to tobacco products and cosmetics. So there's definitely a lot under the agency umbrella, and one of the things that they've created is called a Human Foods Program, which oversees all the FDA's activities around food safety and nutrition. So food safety includes a few things. So food safety includes pathogen-related foodborne illness, and of course, this has been top of mind with H5N1 being found in raw milk, and with all of the surveillance that is going on around H5N1, but also a number of things that I've reported on here over the months, like salmonella outbreaks, E. coli outbreaks, listeria outbreaks, and these are increasing. There were more in 2024 than we had seen in prior years, so glad to see what is called an Office of Microbial Food Safety to specifically look at pathogen-related foodborne illnesses. And if you're interested in all this stuff, there's actually quite a lot of information on the FDA website. I put a link in the post if you are interested. But just to give you a sense, the Office of Microbial Food Safety actually includes an Office of Dairy and Seafood Safety and Office of Produce Safety. So this is welcome news, because we've definitely seen an increase in these foodborne outbreaks and illnesses in all of these food categories of dairy, seafood, and produce. And in addition to microbial food safety, there is also going to be an office focused on food chemical safety. So that office is going to be focused on things like additives and dietary supplements, including how they assess the safety of these additives and supplements after they are on the market. So this strikes me as a very important area. I'm going to touch on one example in just a moment. And last but definitely not least, I'm glad to report that there is now a nutritional center of excellence. And so this is going to focus on nutrition and food labeling, as well as, and this is important as we've seen, the regulation of infant formula, as well as medical foods. So I'm certainly hopeful that all this means there will be more emphasis on the food part of the FDA, and I look forward to seeing what will come of this. If you want to see the new organizational structure with all the related org charts and announcement, all of that is linked in the post. One of the things I found particularly hopeful is that one of the first orders of business for this Human Foods Program seemed to be updating what is meant by FDA's nutrients claim of, quote, healthy, unquote. So this seems like a bit of a work in progress, but what we have so far is an updated definition of healthy, because apparently it's been over 30 years since the definition of what the FDA called healthy was developed, and it has not been updated since. And what they have here definitely appears to be an improvement. They're looking at saturated fat, so not just total fat, but saturated fat. They're looking at added sugars. They are looking at sodium. And just to give you a sense, that here's a few things that they used to call healthy that no longer qualify to be called healthy. That includes those little yogurts that have a lot of added sugar, cereals with added sugar, white bread without whole grains, fruit snacks and snack bars and fruit punches that have added sugar. So those no longer can call themselves healthy. So this is important, because that is based upon our understanding now that would be misleading to call those things healthy. And here are just a few of the examples of things that are deemed healthy. And some of these were not considered healthy previously. Probably most famously would be eggs. I appreciate the specific call out of water being healthy, as well as, although I wish it wasn't in a plastic bottle there, we can probably talk about microplastics in a future briefing, but glad to see that water itself is being called out as being healthy, as well as, of course, fresh whole fruits and vegetables. So seems like we're moving in the right direction here, and I'll continue to report more as we see more work being done in this space, because this really does have the promise of improving the health of our country, because these are the guidelines that regulate labeling of food. These are the guidelines that schools look at, institutions look at. And so this is all hugely important. And looks like we're heading in the right direction. Don't know with the new administration whether or how that would change this, but at least there are some wheels in motion on this. And related, and this would fall under that chemical safety aspect of the food that I mentioned, this is the discussion of red 3 dye and the potential for it being banned from our food. Now, to my knowledge, there is not a date set yet, but we're hearing that the FDA is considering a ban of red dye 3 from our food and beverages. So last month, the Senate Help Committee, which is the Health, Education, Labor, and Pensions Committee, I've actually shared recordings from that committee before when they were addressing long COVID, but that same Health Committee took up this topic of dye, red number 3 dye last month, and they reviewed a petition to basically repeal the regulation that allows for the use of FD&C red number 3 in food. And in that committee, they said that they hope that they'll be acting on this petition in the coming weeks. Of course, it's been about a month and there hasn't been any action yet, but hopefully that will come soon. Basically, the issue is that red number 3 is made from petroleum. It's been found to cause cancer in animals, in laboratory studies in animals. It has been linked to behavioral issues in children. It has absolutely no nutritional value whatsoever. And it was already banned from cosmetics and topical drugs back in 1990. So if something is carcinogenic in lab rats, it's already been banned from cosmetics and topical drugs, has absolutely no nutritional value whatsoever, and is simply being used essentially for marketing, why should it be allowed in our food? Many other countries do not allow it. California has already passed legislation to ban not only number 3, red number 3, but also red number 40 and yellow number 5, and a number of other ones from public school foods and drinks by 2027. And several other states are also advancing similar legislation. So sorry about those of you who like your red foods. A lot of companies have already gone to more safe colorants. So I think that hopefully that trend will continue. But we deserve not to have chemicals in our food. Our children deserve not to have chemicals in their food. And as I mentioned, there are a number of studies that tie hyperactivity and other behavioral issues to these dyes. Not in all children, but some children seem to have a reaction to these, and we just simply should not be exposing them to it. It's a carcinogen. So we need to get these chemicals out of our food. Like I say, some companies are already shifting. Hopefully they'll all see the writing on the wall and go ahead and make the shift. But unfortunately, we know that anything that makes it cheaper and more attractive, you're probably going to have to ban it before it actually gets out of all of our food. So in the meantime, just please make sure to check your labels. A good rule of thumb that I use is that if there is a color or a number in the ingredients, it's probably not good for you. So that is my pro tip of the day. And in addition, let's maintain our best practices to prevent the spread of respiratory illnesses. Let's also keep in mind the guidelines for respiratory illness vaccines, the recommendations, and some of these have been recently updated. So make sure you're familiar with those. And remember to eat a balanced diet, incorporate fresh fruits and vegetables, avoid those sugary drinks and processed food and chemical additives in your food. Get some regular physical activity. Unless you don't feel well, in that case, please do get your rest. Manage those stress levels and get a good night's sleep. This concludes today's People's Health Briefing. Please take a moment to complete our survey linked in the post. And thank you so much for joining us. We'll see you again next Tuesday at 10 a.m.